Hello everyone, let's resume the orthodontic synopsis. In cephalometry, the exposure parameters are usually 75 to 80 kVp, where kVp stands for kilo voltage peak. This is the highest voltage used, and 7 to 8 MA, that is milliampere. This is the amount of current passed through the X-ray tube, and that is for 0.8 second. Okay. Then we have the distance between the X-ray film and mid-sagittal plane of patient's head, which has to be 18 centimeter or 7 inches. Let's have a look in the picture. In this particular picture, you can see the sagittal plane or mid-sagittal plane that divides body into right and left halves. Then there is transverse plane, which is red. It divides the body into the upper and lower half. Then you have frontal plane, which is marked in green, that represents the front and back. The distance between X-ray tube and mid-sagittal plane of patient's head is 5 feet, 60 inches and 152.4 centimeter. So the distance between the X-ray film and mid-sagittal plane of patient's head has to be 18 centimeter or 7 inches, and the distance between the X-ray tube, that was the film and this is the tube, is 5 feet or 60 inches or 152.4 centimeter. The magnification of 5 to 7% is considered normal. Okay, this has been asked in PGI 2005. Then we have some landmarks that are anatomic and derived landmarks. What are anatomic landmarks? These are that which represents actual anatomic structures of the skull. Derived landmarks are those that have been obtained from anatomic structures in cephalogram. Okay, so these are the points on cephalogram. What is nasion? It is the midpoint of frontonasal suture. Orbital is the inferior point of orbit over here. Then pterygomaxillary fissure, this one. Pterygomaxillary fissure is the most posterior point on the outline of the pterygomaxillary fissure, and this is at the base of it. Okay. Then anterior nasal spine. It is the anterior point of maxilla. Then we have point A, which is the deepest point on the maxilla below ANS. Below, this is located below anterior nasal spine. Okay, then we have point B, which is the most posterior point on the bony curve of the mandible above pogonion. Okay, तो ये है point B जो pogonion के ऊपर है यहाँ, और ये है pogonion. Okay, then we have pogonion, which is the most anterior point of bony chin. This is the most anterior point of the bony chin. This particular point is called pogonion. Then we have nathion, which is most anterior inferior point on the bony chin. This is the most anterior and inferior point on the bony chin. Then we have menton, which is the lowest point on the symphysis of the mandible over here. This is the most lowest part on the symphysis of the mandible, which is known as menton. Okay. Then we have gonion over here, which is the most posterior and inferior point on the outline of the angle of the mandible. Okay, so this is the most posterior and inferior point on the outline of the angle of mandible. Then we have posterior nasal spine, this one. Okay, the posterior nasal spine, this is the most posterior point of bony hard palate. Okay, then we have Bolton point. This is the intersection of the outline of the occipital condyle and the foramen magnum at the highest point on the notch of the posterior to the occipital condyle. Okay, over here, this is the Bolton point. Then we have Basion, the most inferior posterior point on the anterior margin of foramen magnum. Okay, so this is the most posterior and inferior point on the anterior margin of the foramen magnum. Okay, then we have articular. Articular is the intersection of the posterior contour of the condyle and the posterior cranial base over here. Okay, this is the condyle. Okay. Okay. Then there is porion, which is located over here. This is the top of external auditory meatus. Okay, this is the top portion of the external auditory meatus. Then we have the spheno-occipital synchondrosis. This is the junction between the sphenoid bone and the occipital bone over here. Okay. Then there is sella, which is a midpoint of sella turcica. This is the midpoint of sella turcica. It is known as sella. We have seen all these points wherever these are located, except superior and inferior procyon and condylion. So this is the superior procyon and this is the inferior procyon. Okay, so the superior procyon is the most inferior anterior point on the maxillary alveolar process between the central incisors over here, this one. Okay, and the inferior procyon, this one. This is the most superior and anterior point on mandibular alveolar process between the central incisors. And the last one is condylion, which is the most superior point on the head of the mandibular condyle. So it is located over here. Okay. Okay, so let's revise once again. This is nasion, this is orbital, this is pterygomaxillary fissure, then this is ANS, anterior nasal spine, this is point A. Here you have the superior procyon and then the inferior procyon over here, then point B, pogonion, gnathion, menton, gonion over here, posterior nasal spine, this one, Bolton point over here, Basion, this particular point, articular, okay, porion over here, then spheno-occipital synchondrosis, this one, then we have sella over here. Okay, and there's one more point which we read is condylion over here. Okay. All anatomic landmarks except gonion and condylion are unilateral. Gonion and condylion are bilateral in nature. Derived landmarks are bilateral in nature. So all the derived landmarks are bilateral, but in anatomic landmarks only gonion and condylion are bilateral. Otherwise all are unilateral. So that's all for today. See you in the next video. Thank you for watching.